dental caries to begin. You can help prevent cavities from developing by brushing after meals and snacks at least twice daily for 2 full minutes. Try to cut back on sugary snacks, soda pop, and sports and energy drinks. Otherwise, what's going on in these teeth could happen to yours. If food deposits are allowed to stay in the pits and fissures of the teeth, bacterial acids and enzymes can dissolve away the enamel. Acids from food and drink can also directly dissolve, angling the bristle tips beneath the gums, and then flossing between the teeth every day to get rid of the fuzzy plaque.
To keep healthy teeth, we have to brush for 2 minutes every morning and 2 minutes every night before bed. It's really important to brush your teeth the right way. First, make sure to use a special kid's toothbrush when you brush. Kids' brushes fit little mouths and have soft bristles. Put a little dot, about the size of a pea, of fluoride toothpaste on your brush.
Remember to use a medium toothbrush, not a hard brush. Hard bristles cause abrasion of the enamel and recession of the gum line. We will explain how to brush, floss, and complete oral hygiene. Doctors recommend dividing the mouth into 4 parts called quadrants. Brush your teeth 1 quadrant at a time. Remember, use just enough toothpaste, not too much, to avoid gagging and noise in the mouth. Start with the upper quadrants, 1 and 2. Remember to brush 1 quadrant at a time. Start with the facial surface. Start at the back. Start at the gum line in the direction of the arrow. Go down toward the lingual surface of the teeth. Remember to brush each tooth 3 times. 1, 2, 3. Move over each tooth from back to front. Go all the way around both quadrants. Now we'll move to the lingual side and the palate. Start on the underside. Start at the gum line. Brush down toward the lingual surface of the teeth. For molars and premolars. When you get to canines and incisors, brush vertically as shown in the video. Now we'll brush the occlusal surface. Take your toothbrush, run it in the direction of the arrow, back and forth as shown. Do the same for both quadrants. Now we'll move to the bottom, quadrants 3 and 4. Starting just as the upper quadrant on the facial side. We're going to start at the gum line, brush in the direction of the arrow. Remember to brush each tooth 3 times. Remember to brush behind that back tooth to make sure you get everything. Always open your mouth when you brush your teeth. Brush all the way around both quadrants. Moving to the lingual surface. Start at the gum line. Brush up toward the occlusal surface of the teeth. For molars and premolars. Once you get to canines and incisors, remember to turn your toothbrush vertically and brush each tooth vertically 3 times. Now we'll brush the occlusal surface. Just at the top, you want to run your toothbrush back and forth over the occlusal surface of the teeth. Do the same for both quadrants. Another important part of oral hygiene is cleaning the tongue. Stick your tongue out, run the toothbrush in the direction of the arrow, starting back to front. Remember to pick your toothbrush up and start back to front once again. If your toothbrush looks like this, you need a new one. You should have a new toothbrush every 2 to 3 months.
Mouth and brush in little circles. Work your way to the teeth in the front of your mouth. And don't forget to brush the gums. Move the brush back and forth, gently in short strokes. Brush the top, front, and back sides of each tooth. Make sure you get the insides of all the teeth. When you're done brushing, it's time to their children's teeth as soon as they have 2 teeth that touch, and they should floss twice a week. When you floss, break off about 18 inches of floss. Wind the floss around your pointer finger. Hold the floss tightly between your thumbs and your fingers. Guide the floss between your teeth using a gentle rubbing motion. Never snap the floss into your gums. When the floss reaches the gum line, curve it into a C shape against one tooth. Hold the floss tightly against the tooth. Gently rub the side of the tooth, moving the floss away from the gum with an upward motion.
The neck, matching the grooves on the handle, and push until you hear a click. As you move the brush slowly over your teeth, you will notice a change in the sound the brush makes, indicating that it's properly adjusting the cleaning action for each tooth surface. Colgate Proclinical A1500 at the front and back surfaces of the teeth, where it automatically provides gentle side-to-side strokes to sweep away plaque. Hold the brush at the gum line at a 45-degree angle, where it automatically adjusts to deliver mid-speed massaging strokes to minimize damage to the soft tissue and stimulate the gums to help maintain gum health. Finally, hold the Colgate Proclinical A1500 atop the molars to clean deep into the hard-to-reach areas with higher speed pulsating. Proclinical A1500, the first electric toothbrush with smart sensors that automatically adjusts for a superior clean at the push of a button.
A new name, the Waterpik Water of their oral health, and it's ideal for those with special dental needs. There are 6 unique tips specifically designed for their individual needs. For your orthodontic patients, the orthodontic tip is clinically proven to be 3 times as effective at removing plaque biofilm versus string floss. For patients with periodontal pockets, the pickpocket tip can deliver antimicrobial agents deep into periodontal pockets, up to 90% of a 6mm pocket. The toothbrush tip allows patients to brush and water floss at the same time. And the tongue cleaner tip removes bacteria from the tongue and helps to eliminate bad breath. The classic jet tip is the attachment most have been using for years. It removes plaque biofilm deep between teeth and below the gum line, while massaging and stimulating the gingival tissue. And introducing the new Plaque Seeker tip, designed to give your patients the benefits of pulsating water, plus 3 thin tufts of bristles to access stubborn plaque around implants, crowns, bridges, and other areas that are susceptible to plaque accumulation. Now you can give your patients an easier and more effective alternative.
By the time you're 7 or so, you should be flossing every night at bedtime with your mom or dad's supervision. One other way we can keep our teeth clean and healthy is by eating and drinking healthy foods. Eating healthy foods for breakfast, lunch, and dinner is the best way to keep your teeth and whole body in good shape. If you're hungry and want a snack, try foods like fruit, raw veggies, and low-fat cheese. Stay away from sugary sodas and sweets. If you're thirsty, drink water or low-fat milk. If you brush, floss, and eat right, you'll have a beautiful smile for your entire life. Find an Every Kid's Dentist location or request an appointment today by logging in at www.everykidsdentist.com.
الشيطان الإنسان الذي معه سواك يهرب منه على أمتي لأمرتهم بالسواك قبل كل وضوء وفي رواية قبل كل صلاة.
Toothbrush. It is completely biodegradable and can be used